Welcome to this high-yield Anesthesia Learners Academy explainer. You know, if you're a med student aiming for anesthesia just because you think it's this perfectly balanced lifestyle branch, or maybe you're a resident eagerly awaiting that massive paycheck, well, we really need to talk. The game has drastically changed for 2026. The traditional path? It isn't just a career anymore. Honestly, it's a trap. Today, we're pulling back the curtain on the grim reality of anesthesia burnout, and we're going to map out the exact institutional and individual remedies you need to build a genuinely trap-proof career.
Okay, let's dive right into this. The data we're looking at is absolutely staggering. According to a comprehensive survey of anesthesiologists, a massive 59.2% are at high risk of burnout. Just think about that for a second. More than half of the very people keeping patients alive during the absolute most critical moments of their lives are themselves emotionally exhausted, completely detached, or feeling a total lack of personal accomplishment.
And look, if you're thinking, that's just a problem for older, late-career physicians who've been at it for decades, think again, 38%. That is the prevalence of burnout right now among anesthesiology trainees and residents. Before they have even fully started their independent careers, nearly 4 in 10 are already burning out. It just proves that the old advice of put your head down, work hard, and it'll get better is fundamentally broken.
Now, zooming out to the global picture, particularly in low and middle-income countries, like right here in Pakistan, the burden is exponentially worse. In some LMICs, there are a staggering 1,000 times fewer appropriately trained anesthesia providers compared to high-income countries. That is wild. The clinical workload is absolutely crushing. Resources are severely limited, and the pressure to perform is unrelenting day in and day out. This completely validates the sheer exhaustion our local doctors are feeling.
So the crucial point is, this isn't just about needing a nap or feeling a bit tired. The ultimate cost of this crisis is literally measured in lives. An estimated 300 to 400 physicians die by suicide every single year. For female doctors, they face a 250 to 400% higher suicide risk than their non-medical peers. Over 60% of anesthesiologists suffer from severe excessive daytime sleepiness, which directly leads to really dangerous medication errors. And tragically, anesthesiologists have high lethality access to the very drugs used in the OR, pushed to the edge by a medical culture that demands absolute perfectionism but offers zero emotional support.
Let's move into Section 1, the 3 burnout traps. If you don't see these 3 specific traps coming, you're going to spend the next 20 years exhausted, unrecognized, and totally financially stuck. We're talking about the active income cage, the identity crisis, and the hustle trap. Let's break down exactly how these function in the real world. Trap number 1 is the active income cage. As an anesthesiologist, you're highly specialized, right? But your income is tied exactly one-to-one to your time. If you aren't literally standing at the head end of the operating table, you are not making money. While other industries build these smart systems that generate value while they sleep, we're conditioned to just work more hours. But here's the kicker: with inflation and shrinking corporate hospital margins, your per-hour value actually drops every year. You end up running faster and faster on the hamster wheel just to stay in the exact same place. Then we have trap number 2, the identity crisis. Let's be honest with ourselves. We are the shadow heroes. Patients pick their surgeons, they bring the surgeon a bouquet, they thank the hospital, but the anesthesiologist, you remain the ghost in the OR. Because patients don't ask for you by name, you just become a replaceable service provider. If you leave tomorrow, corporate healthcare chains will replace you with another MD within 24 hours. You become a commodity, getting squeezed by the system simply because you lack leverage. And that leads us directly into trap number 3, the hustle trap. To try and reach their dream income, brilliant doctors essentially start selling their souls. They'll take 10 locum night duties at distant nursing homes. They'll rush across the city for a freelance case at 2 a.m. just for a few extra 1,000 rupees. On paper, sure, the bank balance looks great. But at what cost? You miss your kids' birthdays, you develop chronic dark circles, and you trade your absolute peak physical years just to keep that active income machine running. Okay, moving right along to Section 2, institutional burnout remedies. And this brilliantly illustrates what we actually need to do to transform the work culture. We have to look past those mandatory wellness modules and the completely insulting hospital pizza parties. The research points to specific evidence-based interventions. Things like Circle Up, which introduces authentic on-shift briefings so team members can actually express expectations and set boundaries. There's Team ICU, to build a supportive shared language that normalizes vulnerability.
The Hello Bundle uses small daily actions to boost the emotional climate, and meaning-centered psychotherapy reconnects doctors with their deeper why. Together, these strategies build an environment of active benevolence and vital peer recognition.
But beyond just communication, institutions absolutely must restore flexibility. Burnout is so often triggered by a rigid lack of adaptability. Implementing flexible schedules and a fairer distribution of on-call duties based on individual capacities is absolutely crucial, and honestly, it can be supported by something as simple as automated smartphone alerts and reminders. These simple tech tools drastically reduce cognitive overload and streamline workflows. It literally gives anesthesiologists their mental bandwidth back.
Now for Section 3, the Individual Remedy Playbook.
See, the old way was simple but flawed. Get your MBBS, get your MD, enter the corporate grind, and inevitably become a replaceable commodity. The 2026 way is radically different. It requires you to step up and become a multi-dimensional medical brand. It relies entirely on skill stacking, becoming AI augmented, and building a digital OT.
This right here is your exact 3-step roadmap to stop being a backup and start being the backbone of the specialty. Let's look at how you can apply each of these steps immediately to reclaim your time, your income, and most importantly, your sanity.
Step 1 is skill stacking. You need to dominate a subspecialty. Don't just be an anesthesiologist who does general cases day in and day out. Master OPD-based skills, like interventional pain management or chronic pain. When you treat a patient's chronic back pain, they don't see the hospital, they see you. This moves you off the hospital's payroll and onto your own dedicated patient list. You stop chasing cases because the cases start chasing you. Step 2. Become an AI-augmented doctor. While others are terrified that AI will replace them, you need to use it to move 10 times faster. You can use clinical decision support to actually predict hypotensive episodes in the OR before they even happen. You can use ambient AI scribes to instantly automate your patient education notes and slash your paperwork. Using technology properly lowers your medical legal risks and literally buys back hours of your life every single week.
And step 3 is building a digital OT. Look, your knowledge is your most valuable asset, and if you only ever share it with one patient or one resident at a time, you are wasting it. By creating educational content, you essentially create a digital twin that works, teaches, and builds your reputation while you are sleeping. You transform from a hidden service provider into a key opinion leader. When a hospital sees you have 50,000 people following your expertise, well, suddenly you have real leverage to negotiate exactly what you're worth.
Let's move to our final section and see how this all builds up to reclaiming your career.
Ultimately, overcoming these massive challenges, especially in LMIC healthcare settings, comes down to a simple truth from Charles Darwin. It is not the strongest of the species that survive, nor the most intelligent, but the one most responsive to change. We must cultivate resilience, emotional intelligence, and relentless adaptation to navigate the compounding pressures of our field today.
The 2026 anesthesia trap is very real, my friends, but falling into it, that is entirely optional. We've laid out the roadmap for you, and now the choice is yours to make.
If you're ready to stop just surviving medicine and start truly owning it, join us. Please like this explainer, subscribe to the Anesthesia Learners Academy channel, and share this with your colleagues who desperately need to hear it, because I'm going to leave you with this final, crucial question. Will you continue to be the ghost in the machine, trading your sleep for rupees, or will you adapt, skill stack, and become the doctor who owns it?